Welcome to Managing AML. I am Dr. Naval Daver. I'm frequently asked what are the latest updates on the IDH1 and IDH2 inhibitor studies. So the IDH1 and IDH2 inhibitors have shown very promising activity in patients with acute myeloid leukemia. The IDH2 inhibitors were the first one to go into clinic about 2 years ago, and now there have been about 200 plus patients enrolled on these studies. The overall response rate is about 35 to 40%, including 20% that are CR and an additional 15 to 20% that are partial responses and hematological improvement. One of the key features we have noticed is that a lot of the responses, including the partial responses or hematological improvements, have been very durable. And so this is a new era for acute myeloid leukemia, where patients who do not achieve complete remission may have prolonged benefit from some of these agents. The other thing with these agents is that they're oral, so easy to administer, and they have minimum toxicities. Are extremely well tolerated. We have seen a few instances of transaminitis, and usually it is reversible. So all in all, I think the IDH1, IDH2 inhibitors are a breakthrough for AML therapy, being oral agents, and they target the particular mutations. One of the points to note is that the IDH2 mutation is present in about 8 to 10% of patients, and the IDH1 is present in about 10 to 12%. So they don't cover all AMLs, but they are good options for the 15 to 20% of patients who have an IDH1, IDH2 mutation. Further, these drugs are now being developed in the frontline setting in combination with standard approved agents for AML, such as azacitidine plus IDH inhibitor for the older patients who are not fit for intensive chemo, and then 3+7 or high-dose chemo plus IDH inhibitor in the younger population. And I think these studies will be even more interesting to see if we can get more durable remissions that will then result in early survival by using targeted therapies with chemotherapy upfront.